Right, hello and welcome to BizTalk, and this is a program which we will discuss on matters concerning the national key economic areas and companies that involves directly or indirectly to the economic transformation program. And I am your host, Suryati Sanusi, and today we have a very interesting topic which is about chiropractic, which is an alternative medicine. And today on my left is Dr. Yama Zafir. Right?
Correct.
Okay, he is a doctor of chiropractic at Chiropractic Specialty Centre, and on his left is Mr. Wasim Islam, also from Chiropractic Specialty Centre, which he is a director. Welcome to the show.
Thank you. Thank you.
Right. Right. Tell us a little bit on both of you. I know you are here, part of the My Second Home program. So Wasim, could you start?
That's right. I moved here from Dubai, where I was a resident for about 5 years.
Okay.
And I was seeking another interesting place in Asia to go to. And Malaysia came up tops. And also the MM2H program offered me a very reasonable residency status here with my family.
Right.
And it gives me quite some freedom to start businesses, to invest in local initiatives. And it was perfect. So I moved here 4 years ago on the MM2H program.
Okay, and Dr. Yama, how did you end up here in Malaysia?
Well, my story goes back 8 to 10 years ago.
Okay.
And that is when I started to, I noticed some shortcomings in spine and joint treatments. And I wanted to innovate the system of how non-surgical treatments were rendered, and I came up with a system of treatment, specifically the NSD treatment to our machines, the decompression machine for lower back.
Okay.
I started that in US, but unfortunately it was difficult for me to continue with R&D, as US is very expensive in doing that. So I looked abroad, and I looked at many countries. I looked at Egypt, okay, and I went to Egypt.
Right.
Loved the Egyptians, loved everything, but I didn't like their system.
Okay.
And then I was told about Malaysia. I came to Malaysia and I fell in love with it.
Right.
And that was in 2005.
Right.
6 months later, I moved in. So that was it.
That is very fast.
Yes.
You brought the whole family
Our whole family. We packed up and moved to Malaysia.
Right.
And didn't know a single soul when I first came in. So we had to start from
scratch. Okay.
MIDA provided us with a lot of assistance.
Okay.
And I honestly believe that I could not have done it without their help.
Right.
They offered a lot of assistance, and every turn they were there holding my hands.
Really?
So they did very well.
Okay.
So and they helped us out. They guided us, and it's been very well.
Right. Let's talk about the center itself. How did it get started?
As I said, I came to do R&D.
Right.
My plans originally was to stay in Malaysia 2 to 5 years, do research, do development, do patents, and go back to US.
Okay.
And fabricate my machines there.
Okay.
But the more and the longer I stayed here, the more and longer I felt more and more like it is home.
Right.
So, and then I was asked by many to treat them, and that's how I started also my center in Bukit Damansara. So that's how it started. We started the chiropractic center, combination of chiropractic and physiotherapy.
Right.
But what made us different is our equipment and our system of treatments, our methodologies, and our equipment.
Okay,
so
we have a package on that because one of my journalists went there and to look at your center. So let's take a look at the package right now.
Chiropractic Specialty Center is set up by individuals who are in the pursuit of excellence. With their group of staff who continuously strive to increase their knowledge of treating their patients effectively and efficiently, Chiropractic Specialty Center not only keep up with the latest research and innovations, but have also developed and patented new therapeutic procedures for the spine, joint, and sports-related injuries. Chiropractic Specialty Center expert team of physiotherapists and chiropractors are further back with some of the latest and most sophisticated physiotherapeutic and chiropractic equipment such as the RX-Decom. Chiropractic Specialty Center expert team of physiotherapists and chiropractors are further back with some of the latest and most sophisticated physiotherapeutic and chiropractic equipment such as the RX-Decom. The RX-Decom is a state-of-the-art spinal decompression therapy device specifically used to acute chronic neck pain or back pain. Due to its sophistication, we can treat even the difficult and challenging conditions such as slip disc.
I had my first incident with a slip disc when I was 20. That is 26 years ago. So when I came to Malaysia, I was very active with sports. I did karate and motorbike and all these things. But my job itself, I needed to do a lot of heavy lifting. And one fine day, actually, it just collapsed.
Chiropractic Specialty Center also utilize other modalities and specific manual procedure not only for the spine, but also for joints and sports injuries. Regardless of which therapy or modalities Chiropractic Specialty Center recommend for you, rest assured that Chiropractic Specialty Center will only recommend a therapy program that is able to help.
After we started treatment on the RxTcom, after 30 sessions, I had no more pain. My pain was gone. I could walk, and I did not use the cane anymore. And I went back to the hospital because to get an appointment with a surgeon in Malaysia in a public hospital, it takes 3 months. So when I finally got my appointment, he did some tests and he asked me, "Do you have pain?" I said, "Right now, no more pain." Then he asked me, "What did you do?" I said, "I went to see the chiropractor." Then he said, "Why don't you stick with the chiropractor?"
Furthermore, it is not only the equipment or the facilities, but most importantly, it is the skills and knowledge of the Chiropractic Specialty Center staff coupled with an undying passion to help each and every patient. Due to its commitment and excellence, Chiropractic Specialty Center has been chosen to be the first center in Southeast Asia to offer NSD therapy. The non-surgical decompression therapy, or NSD therapy for short, is an alternative to spinal surgery. It combines technology and medical science in a complex system of spinal rehabilitation. It is specifically created for the treatments and rehabilitation of spinal-related ailments without having to resort to invasive surgery. So one day, if you decide that you need your self-checkup for any physical pain, remember that Chiropractic Specialty Center is a fully equipped chiropractic and physiotherapy center that specializes in the treatments of spine, joints, and sports-related injuries. If you are facing any physical injuries, including slip disc, surgery may not be your only option. Here in the Chiropractic Specialty Center, they offer you a 97% of cure without any surgery and also proven track record of 7 years in Malaysia. I'm Nora Ashraf, reporting for BizTalk.
Right, that was an interesting package on the centre. So probably you can elaborate more on what you have there at the centre.
Absolutely. Well, I'm a former patient myself.
Okay.
And so is my business partner,
right,
who is also Malaysia, my second home.
Okay.
Basically, we both had slip disc problems. We had severe mobility issues. And Dr. Yama helped us through our treatment. So we are essentially believers from the beginning. I believe I did about 36 sessions in the clinic because my condition was not only severe, but it also, I didn't follow the treatment as I should have.
He wasn't a very good patient. Very active.
So I was doing exercise in the middle of the treatment, which is not, it's really not recommended. And I relapsed, and I created worse. The problem got worse in that condition.
Were you able? You still walking by then?
I was, but I slipped 2 discs, and that's quite excruciating. It knocked me out for a good 10 days, and thereafter limited mobility. But I got straight onto decomp, which is NSD therapy. It's non-surgical decompression, spinal decompression, and essentially over the next about 25 sessions, I'm back. I'm fully recovered. And today I'm back. I'm very active. I'm up to a lot of sports, and I absolutely am not curtailed in any way. And so, as a believer, the opportunity came up, you know, through Dr. Yama to set up a center of our own, and he supported us.
We are a franchise. We are a franchise.
Probably you can explain on that.
Franchisee. So
so I looked at the package, and it was very interesting. And Dr. Yama offers a very good business model, and I know enough about the treatment, and I'm motivated enough as a sales, my background is sales essentially. So I was very motivated, and I'm always looking for innovation to invest in, and this is innovation in traditional medicine, right? So many people have an impression of chiropractic care that it's really just treating the pain. They try to manage your pain, they move some bones, and by the time you get back to them again, it's gone, right? So we acknowledge that, we understand that that's the perception, not always accurate, but we have added innovative technology into our solution. And that technology patented right here in Malaysia. A very unique equipment, nobody else has it. And through it, we're able to demonstrate results, case after case after case. And in fact, we've brought some of our references with us today.
We will introduce them later in the segment.
Absolutely.
And to talk about technology, Dr. Yama would be the best person to talk about it. So,
the main equipment that we have that we treat patients to, especially for those similar to Wasim's case, the slip disc, spinal disc herniations, protrusions, even extrusions, or some fragmented discs. These are cases that are traditionally or typically told by their physicians to have surgery. So we're treating them non-surgically without the need for medication, injections, or any form of surgery at all, through our system of therapies and the equipment that you just showed in the clip earlier. The big blue one, that is our RX decom. That is at the heart of our system. That is the heart of our niche treatment program that we offer to patients. And it's extremely sophisticated. It has quite a bit of sensors and a lot of technology in it that monitors every patient and continuously while the patients are on the machine. And it's the first physiotherapeutic machine in the world that has remote monitoring control. So that way a patient that's on the device does not need to be interrupted by the therapist or by the doctor to see how they're doing. We can monitor them remotely, not meaning through a camera where we can see the patient, not monitoring through camera, but monitoring them through sensors. And not just human monitoring through the computers, but also the computer itself, the program itself monitors patients. So it's a very complex system.
Okay, we are bringing up the patient later, so probably you can introduce the doctor and the patient after this, and what kind of treatment that the patient is doing.
The patient that is going to be brought in is going to be brought in by Dr. Kimball. Dr. Kimball practices in Wasim's center in Ara Damansara, in the Oasis Center, the new one that they've built in there. And they have a very interesting patient that was in significant amount of pain, difficulty while she was walking. So Dr. Kimball is going to bring that case and discuss the treatments that we've done. The treatments that we do is through this machine, the blue machine that you just saw. But it's not just that machine, it's a system of treatments. It's physiotherapy, chiropractic, the machine that you just saw on the machine, and the other machine, that exercise machine that you will see, and multiple machines. So it's about 7 different procedures that are rendered for patients with slip disc. Because slip disc is very complicated, so it needs all of those procedures, and Dr. Kimball will introduce them.
Okay, we'll take a short break right now, and we'll introduce Dr. Kimball after this. So stay here, right here on BizTalk.
Catch Bernama Today every weekday from 9 AM onwards for the latest news, lifestyle stories, interesting personalities, only on Bernama TV.
Masa, mengupas isu semasa, jadi saluran pelbagai suara, segalanya baru dan benar di Berita Bernama TV.
Balai Seni Visual Negara dengan bangganya menjemput anda meraihkan program-program sempena sambutan 55 tahun Balai Seni Visual Negara. bermula 23 Ogos 2013 bertempat di Balai Seni Visual Negara. Untuk maklumat lanjut, layari www.artgallery.gov.my.
Right, thanks for staying with us on BizTalk. If you have any comments, you can email us at biztalk@bernama-tv.com, or you can tweet us at biztalk502, or you can call us at 0326937008. And right now, we have Dr. Brian Kimball with a patient. Can you introduce your patient here?
This is our patient, Natasha.
Okay, so what kind of treatment is she having, or was she had before?
Actually, before this, she didn't really have much treatment.
Okay.
She actually saw doctors literally around the world, in Australia, Miami, Florida,
Right.
neurologists.
Right.
They really couldn't find out exactly what her problem was.
Okay.
Their answer was drugs.
Okay.
She was on a lot of pain medication.
Okay, let's ask her, what happened to you and what kind of pain do you have?
Well, I had a car accident 2 years ago.
Okay.
It was a rollover car accident,
Okay.
for which I was passenger at the back.
Okay.
And I didn't have any problems then, but a couple of months ago, sometime in March, I actually fell down on the road. And
This year you're talking about?
This year.
Okay.
And that triggered, I guess that triggered all the whole cascade of events,
Right.
of which I started having numbness on my feet.
Okay.
Started having tingling, lots of shooting pain down to my feet, burning sensations,
Okay.
hypersensitivity to my feet, where I could not even put any type of materials on my
Wow.
feet.
The sound of it makes me in pain already. Okay.
At that point, I first went, because I was in Australia and studying over there.
Right.
So I went to the doctors and they couldn't figure out why.
Okay.
So, because all they see is just a fall.
Right. And they don't see anything,
They did not
anything
link
wrong with
to
you?
no, they did not see anything wrong other than it was just a fall. It probably just triggered then
Okay.
and it will go away. They told me to take Panadol.
Right.
And-
So from there, how did you want to try out chiropractic?
Well, I actually, like you said, I went around the world because I actually went to Miami to do some research over there as well, as my candidature.
Okay.
And then I was in so much pain over there. I went to see a neurologist over there again.
Okay.
And he said that, well, there's nothing he can do because I'm only a temporary person over there. He can't actually treat me. So he gave me
Right.
more drugs to take, more
Oh,
painkillers.
gosh. Okay.
But at that time, my walking was so affected that I was limping really, really badly.
Wow.
Every step that I take felt like I was walking on broken glass.
Oh gosh.
And my leg just cramps up in the middle of nowhere. So I literally walked for a couple of minutes and I can't walk. I have to
Right.
stop, rest for a little bit. At that point, I decided I'm just going back to Malaysia.
Right. And who introduced you to the center?
So it was actually my mother.
Okay.
So, because while I was in the States, I actually went for physical therapy, which is just a simple manual one.
Yes.
And that made me better for a couple of days, and then I'll go back again. And then when I came back, I told my mom I want to look for a physiotherapist, and she said, "Oh, why don't we try going to the one that I saw in Oasis?"
Right.
Because she went there. There's a lot of restaurants there, so she just walked past and
She saw it, like I did.
It was brand new.
Yeah.
I think it was just a month into their
just opened
operation.
up.
Yes.
So then she brought me there and started my treatment with Dr. Kimball.
Right. And Dr. Kimball, can you tell us when you first started seeing her as a patient, what did you see? What did you find out?
It was, well, it's troublesome. A young
Right.
lady.
Right.
She could, you'd almost describe her walking as a penguin. She
Oh gosh.
didn't have a lot of forward momentum. It was just side to
Sideways.
side and
Oh.
a lot of pain and problems.
Right.
We did a lot of testing, orthopedic tests. We realized it was probably a disc problem.
Okay.
Sent her out for MRIs. They came back.
It's true
Obviously, a disc problem. I don't know why no one else could find it.
enough. Right.
We did.
Okay. And you have charts there. Probably
Yeah,
want to
these are
share
actually
what
charts.
is-
Actually, talking to her more, getting more information, because patients tend to forget.
Okay.
They tend to forget how serious their accident was.
Right.
She had a car accident. But
Which
we
she-
find out,
Failed to tell you.
there you go, well, she told us, but she failed to tell us it was a rollover accident,
Okay. Which means.
which means, obviously, you have a roof.
Okay.
She could have hit her head on the roof.
Right.
She was getting better for the low back problems.
Okay.
but not as quickly as most of our patients. Usually 3 to 5 sessions, patients start really getting a lot of relief, getting out of pain.
Okay.
She was very slow. I find out this is new information.
Okay.
We do a little bit more testing. I said, I think you need to get MRIs for your neck.
Okay.
Because I think there's more problems being caused.
Right.
So we sent her out again. These pictures came back. These are her MRIs.
Okay.
You are born with a C shape on your curve. When you start to crawl, you need to look. You formed a curve in your neck.
Okay.
And you look. This is the brain up here.
Probably the camera can focus on the chart right now.
Here is the vertebral column of the neck, the cervical area we call it.
Okay.
You can see it's very straight up and down. You should be more of a curve
Curvy.
here.
Oh, okay.
Yeah, so that was one of the things. The disc normally should look white.
Okay. And hers was
Well,
is.
here we see darker ones. We
Oh,
really
it
call
looks
them
like
black.
almost nothing there.
Yeah. So they start desiccating, they dry out. The fluid,
I see.
the disc material has gone somewhere.
Right, that caused her pain.
Yes, cause
Right.
of pain because you can see here the disc is starting to bulge and push into the sac that surrounds the spinal cord.
Okay.
It's a little more difficult to see on these other pictures, but this view actually shows where the disc is pushing onto the nerves, the peripheral nerves that come out and innervate the arms or legs depending which section of the spine this is.
Right.
So she had a lot of problems, especially for her age.
Right, and with that information, what kind of treatment did you give her specifically?
Well, our number one treatment, which is what we specialize in, is the decompression machine, which, as you heard, there's a handful of machines here, and basically all our centers have them.
Right.
It's the latest technology for treating disc problems. So it actually moves the bones, it creates a vacuum, and the disc material is brought back into where it belongs.
Will it hurt when they do it?
No.
Okay.
Actually, the thing is, it's a private room. It's comfortable.
Right.
It's darkened. Some people sleep.
Would sleep in it.
Yeah.
Right.
It's the difference between that and traction. Traction is weights.
Okay.
Pulling.
Right.
Your body doesn't want to be pulled apart, so the muscles tighten.
Okay.
This machine, the muscles are relaxed.
Relaxed.
It's not a straight pull. The pull will go up slowly, come down, go up. So it kind of tricks your muscles into relaxing.
Right.
Opens this disc space up so much more.
Right.
Nothing is better.
And besides that, is she going into other kind of treatment?
We have our physiotherapy. We do, like the doctor told you earlier, we have about 7 different treatments we use. Because one thing alone, open the disc space is good, but the disc with gravity, it wants to come back down. So we have other treatments to strengthen the muscles,
Right.
to relax muscles, to
Right.
work on the tendons, the ligaments. So there's a whole host of treatments like ultrasound, interferential, adjusting. We move the bones.
Right.
Bones get rotated. A bone muscle will get tight on one side.
Right.
It pulls the bone.
Wow.
We pull it back.
Will it slip again?
It's possible, but if you go through the complete course, you follow it, you get well.
Okay.
You
it
saw
will
our
strengthen?
director earlier.
Okay.
He was a patient.
Okay.
He does mixed martial arts now.
Right. Okay, that says it all. So once you got the treatment, do you feel immediately after a few treatments, or gradually?
I started feeling a bit more relief after I started treatment on the neck as well, because I started just on the lower back first for about a week or so. And then as gradually as time went by, the pain subsided and I was able to slowly get off my medication completely.
Right. So you don't take any more
No, I
pills
don't.
and painkillers?
No, so right now I'm completely off my medication.
Right.
Sometimes I may feel a little bit more of a sensitive leg, as you
Right.
might call it, but it's all bearable.
Right. Is she still going for treatment? Is she needing more treatments?
From the thousands of patients we've seen, we kind of have an average. When we look at an MRI, we see how the patient presents. We can kind of estimate about how many sessions.
Okay.
She looks like she's on the track of finishing early.
Right.
She's
And
doing so
you have
well.
gone into how many treatments right now?
I'm at about 20, 21.
21 since?
Since at the start of July, so that's
Right.
about 2 months in.
So is she needed to be in the treatment, the same treatment all the time, or she will be gradually, into things that you use, the small machines that you have there? Would she change into that gradually?
It depends what her symptoms are.
Okay.
Depends how they present when they first come. Some people are in so much pain, we can't do some things.
Okay.
Then we gradually get them on everything. Basically, they stay on that because it's more than just the disc. It's working on the muscles, the tendons, the ligaments. It's a system to restabilize an unstable section of your spine.
Right. Okay. This question: do you really need to be in pain to go for chiro?
No.
Okay, probably you can explain that. Yeah. I mean, how can we benefit? The normal people here could benefit from going there.
Well, we do, depend if you present with a disc problem.
Okay.
We can treat people with tennis elbow, golf elbow. We have a lot of people coming in with playing badminton. I didn't realize badminton was such a contact sport. Everyone's getting hurt playing it.
Right.
But we shoulder injuries. We treat everything.
Right.
So
it's how will it benefit for normal people? I mean, for example, if this person is well from outside, you know, he doesn't have any pain, no joint pains, would he benefit from going there? You know, just
as a
because
preventative measure, yes.
He can.
A maintenance measure. It's good after people finish our treatment. To maintenance once a month. Come in. Check them out.
Do some adjustments.
Yeah.
Okay. All right. We'll go for a short break right now, and when we come back, we'll talk to another patient right here on BizTalk.
Merdeka Special, down the history lane. Merdeka simply means independence, freedom in every sense. Question is how we get here 56 years after we first introduced to our meaning of the word Merdeka. Malaya was governed by the British Empire up until the Japanese invasion in 1941. Following the events of Hiroshima and Nagasaki, the Japanese surrendered on 15th August 1945. The British colonists returned and resumed control of Malaya. Malayan Union was then introduced by the British in 1946, but was strongly rejected by the Malays, who instead were in favor to form the Federation of Malaya. United Malays National Organization was formed to pave the way for independence and preserve the rights of the Malayans. Tunku Abdul Rahman, along with the support from various representatives, head for negotiation with the British in London in 1956. The negotiation was a success, and Tunku Abdul Rahman became the first Prime Minister of Malaya. On the eve of 30th August 1957, Dataran Merdeka was filled with jubilance as Malayans gathered and watched the exchange of Union Jack with Federation of Malaya flag. Negaraku was also played for the first time ever that night. On 31st August 1957, more than 20,000 people gathered at Stadium Merdeka to witness the pivotal moment when Tunku proudly shouted, "Merdeka!" echoed by the crowd 7 times. And each year since, the Merdeka Day is celebrated on that day. 56 years later, we've seen how Malaysia evolved, well on its way to achieving Vision 2020. With excellent achievements such as Kuala Lumpur emerging as one of the top 30 cities in the world. Yet, we must never forget the struggles and sacrifices made by those who significantly contributed in making Malaysia as it is today. Get to know more of Malaysia. Stay tuned for more insights on Malaysia 101.
Right, thank you for staying with us on BizTalk. If you have any comments, you can email us at biztalk@bernama-tv.com, or you can tweet us at biztalk502, or you can call us at 0326937008. And today, we have Dr. Yama Zafir back with a patient. But before that, we have a package. We asked for Dr. Peter Roman for his comments on chiropractic in Malaysia. So let's take a look at the package right now.
To a large extent. One of our greatest challenges is that people don't know what chiropractors are and what they do. At this point in time, all around the world, 80% of the people that go to chiropractors come in with neck pain, back pain, or headaches. About another 10% will come into chiropractors for problems with their other joints, shoulders or knees or feet and things like that. These are all mechanical kinds of problems, the kinds of things that chiropractors really have the best success with. One of the other problems that we see here as the educators, IMU is the only chiropractic program in not only in Malaysia but in Southeast Asia. Okay? It's our job to actually educate and graduate competent chiropractors that are specifically trained to deal with the kinds of problems that Malaysians have here. To be able to design a program like that and to implement that program and deliver it, it takes a lot of extra work for the institution in itself. That's one of our challenges as an institution in itself. What can we do about one of those things? I think that IMDU does a very good job of that. We do a lot of health fairs around the country, and in fact in this region as well, where we educate people about not only IMU's programs, but about chiropractic in itself. In many parts of the world, North America and across Europe, chiropractic is already considered conventional therapy. They work, chiropractors in those countries work alongside of medical doctors, dentists, physiotherapists, and other kinds of medical people. Not in replacing what they do, but actually complementary and providing services that actually help people in as well as what other people provide for them. Chiropractors provide a lot of different kinds of treatment, as it was. We do a lot of physical kinds of treatment in particular. What chiropractors are generally known for around the world is manipulation particularly of the spine. There are other professions that do some forms of manipulation, but 90% of all the manipulation conducted in the entire world is done by chiropractors. It's what we do best. It is our expertise. And that's one of those things that tends to complement other kinds of therapies that other kinds of professionals would provide.
Right, and that was Dr. Peter Roman from IMU. He used the word manipulation, which I think sounds very scary a bit, but...
It can, yes.
Yeah, but it's true, it's manipulation.
It's manipulation. Manipulation, basically, what he means by that is proper realignment of spinal bones. And traditionally, right now, in the West and majority of the countries that have manipulation as a therapy, most of it is done by chiropractic.
Right.
And chiropractors do the best at it because we have researched it the most, more than any other profession in the world.
Okay.
And we have perfected the art. There's different methods of manipulation. There's hands-on, there's instrument assisted. So there's different types of manipulation.
He mentioned that in the US that the chiropractor and the medical doctors work hand in hand.
Correct.
But do we have it here in Malaysia? Do we work hand in hand as well?
Of course. In our centers right now, we have physiotherapists.
Okay.
For instance, in our Bukit Damansara Center, we have 6 physiotherapists. In our Ara Damansara Center, we have 4 physiotherapists. We work with medical doctors on constant basis. We have a general practitioner next door to each one of our centers. Both the Ara Damansara and the Bukit Damansara Center has a GP next door. So we're in constant communication should a patient need their services, and we refer to them for those services. I personally don't believe that chiropractic has all the answers. And I also don't believe that physiotherapy has all the answers, and neither do I believe that medicine has all the answers.
But
I believe in a healthy combination of all. But properly implemented.
Tell us about your patient and the treatment that you gave him or giving him.
Yes, Mr. Chong came into our center a few years ago and significant amount of pain. Actually, the first time I saw him was quite shocking because he literally came in 90 degrees flexed.
Oh, were you still walking, Mr. Chong?
You know, the hunchback of Notre Dame?
A little bit worse than him.
Right. So let's interview Mr. Chong. So how did that happen?
Well, according to the doctors, I probably had a slip disc more than 10, 12 years ago. But it probably didn't hit the nerve or something like that.
You were not in pain back then?
No.
Okay.
And suddenly I got into a lot of pain.
Right.
So I went through a series of 2 orthopedic surgeons, 2 physiotherapists, 2 chiropractors, one of which scared me away.
Why?
Well, drastic measures, I would say, okay?
Pulling you here and there?
Well, I wouldn't put it that way, but I wasn't happy with it.
Okay.
And eventually I met one orthopedic surgeon, and he looked at my case, looked at the MRI, and he said, looking at your stage, I would advise you to see a good chiropractor, physiotherapist.
Okay.
Surgery is the last option, and this is by one of the top surgeons in Malaysia.
Okay.
I valued experience, searched around for some over the net for some chiropractors.
And you
found one. Will always seem to be on holiday. I won't mention the name.
It wasn't me.
Okay.
Obviously, it wasn't him.
All right.
So I think they were very wise because I had a lot of pain, and I think the first issue, instead of putting me on the traditional, what do you call it, traction machine, which they don't, was to ensure that I was stabilized, the term they used, to make sure that I was not in pain, to treat the muscles so that to reduce scarring, and also pain management and stuff like that.
And when is this? Was this last year? Or
2 years ago.
2 years ago. Okay.
2 years ago.
So when you had that problem with your back, so you gradually hunching throughout the years?
No, it was an immediate hunch.
Wow.
Because I could only walk in that position to avoid pain.
Okay, so when he arrived at the center, what did you find out?
Well, first I was shocked to see a fellow in that much of a pain. He was in significant amount of pain. We could not do a lot of the examination tests because he was in agonizing amount of pain. So we went from the MRIs and symptomatology, and we examined him. We discovered that the source of his pain was coming from a disc disorder in the lower spine.
Okay.
And we wanted to put him on our blue machine.
Right.
Okay, but unfortunately, he wasn't stable enough.
He wasn't stable enough?
He was not stable enough.
What do you mean by stable enough?
He was flexed forward at 90 degrees.
You can't even straighten up for a while.
You could straighten up, but it would cause significant amount of pain.
Oh, okay.
When I need to touch a specific spot.
That will give you a jolt.
Agonizing pain, not just a jolt, agonizing pain. Imagine the worst pain possible, that's what he would feel. I mean, at least that's what it looked like when I looked at his face.
Okay.
It looked like a sudden, sharp, severe pain. And he although he didn't say much, he was very good about it, but you could see it in his face that he was in agonizing pain.
I was told not to scream.
Okay. So our focus initially was to stabilize him.
Okay.
Get him to the point where he would be enabled to get on the machine and do the treatment.
Right.
And we spent some time on that. And that was done not just through chiropractic, but chiropractic and physiotherapy.
Okay.
So we worked together on that, and we stabilized them. And then our ultimate goal, we went stages. First, stabilize. And then once it's stabilized, then fix the problem.
How do you stabilize it?
When you have a disc problem like his or any other person that has a disc problem, by the time you have a disc problem, many things have gone wrong.
Right.
Okay? Initially, it could be a muscle problem that if you ignore that, then it can lead to a ligament problem. You ignore that, it leads to a joint problem. And if you ignore all of these initial normal pains that people call them, the normal aches and pains that most people say, I have the normal back pain. There's no such thing as a normal back pain.
Okay. There's no such thing as back pain as well?
There is back pain, but no such thing as normal back pain. A lot of patients in Malaysia tell me, I have the normal back pain.
Right.
So if people ignore the on and off pain that they experience, at least a slip disc. By the time they have a slip disc, and when they come to our centers, we may have to stabilize them first. And a stabilization means that we have to do some therapy for their muscles, do some therapy for their ligaments, do some therapy for their joints.
Combination of stuff.
Combination of 6 or 7 different procedures that we talked about.
Okay.
So these procedures are specific for different structures within their spine to stabilize, to decrease the inflammation, to decrease the pain, so they can tolerate a bit more aggressive of a procedure.
Right.
So we have to go step by step because a lot of people believe no pain, no gain.
Right.
But at our centers, we say no pain, more gain.
Okay.
You don't have to go through more pain to get better. That's insane.
Right.
So this is why we have stabilize you first, and then we do a bit more aggressive.
Okay.
So we go in stages.
Right. Okay. Let's look at the chart. And there's another patient of yours
yes,
with
this
another
is,
pain.
This is a patient that we've treated, an example of a patient with severe back pain. And this is the MRI, if we can zoom in. in this area. This is basically a side view image of the lower back of this patient. This area specifically is where the slip disc is.
Yes.
And you can see the slip disc hanging down.
If it's a slip disc, it's darker, yeah?
Yes. If I can borrow your pen, so I can point with the pen instead of my big fat fingers. Here's this. You can see this is a bone. Let me go show a normal bone.
Okay.
Vertebra, bone, bone. In between the two bones is the disc.
Okay.
A normal disc should have lightish or whitish appearance in the center and grayish on the sides.
Okay.
And in no way should it press or impinge upon this white area. This white area is the thecal sac, meaning the area where the sensitive nerves and the cords are.
Okay.
So in this particular patient, as you can see, the white area is completely obliterated.
Wow.
Gone. There's no white area. Down here it is, up here it is, in here no.
Okay.
This is because he had a really nasty slip disc, a very bad one.
Right.
Very bad one, to the point that where it's sagging down here. And what this is called is extruded with fragmentation.
Okay.
Which means literally, okay, that if a patient has an extruded disc with fragmentation, it is considered by most orthopedic surgeons a surgical emergency.
Right.
Almost any orthopedic surgeon you go to, there's no way this can be fixed.
Yes.
But we can do this.
Right.
We're
With the machines
literally
that you have.
rewriting history or medical treatments with our system of therapies, because we have taken this patient in agonizing pain, could not walk, severe and excruciating pain, who even the surgeon did not want to do the surgery on.
Yes.
And we treated him. We treated him after 30 treatments, 30 sessions of decompression or anesthesiotherapy. We turned this slip disc into this. Again, this is a before therapy MRI. This is the MRI taken weeks before the treatment was given. This is an MRI taken after the therapy was done.
Okay.
And you can see after the treatment retraction.
Right.
You don't see this segment right here, which corresponds to this area. You don't see that fragmentation.
It's a huge difference.
A huge difference. This fragmented disc is unheard of.
Should be a huge relief as well.
Yes, he's a very happy person. He's a happy man. But the beauty about this is this was done non-surgically.
Okay.
No need to go in a hospital. No need for the operation. Done on an outpatient basis. You come into the treatment, to the center, get the treatment, you spend the night at your own house.
How many hours do you spend when you get your treatment, per treatment? How many hours?
Well, depending on the number of sessions.
But 2 hours each session.
Per session, about 2 hours?
About 2 hours.
So when you had your 5, 6, 7 treatments or 7 sessions, how do you feel then? Was it a little bit better?
I think I took probably a bit longer than a normal patient did. But I persevered with it, yes. And I think for me, in my case, I think I felt the difference after probably about 12 weeks.
Okay, which is about
3 months.
3 months.
Okay.
His thing was that we could stabilization.
Oh, that's your first concern.
We had to get him stabilized. We had to get him to the point where he could be treated on the machine first. Lying down. Now, for this patient, for instance, this one, this is severe herniation.
Yes.
Now, we didn't have to spend that much time stabilizing him. Every patient is different. For some patients, we spend
less time, less sessions.
Because a disc problem can cause different types of symptoms for different individuals.
Okay.
There are people with mild disc problems that have severe and excruciating pains. There are those that have severe disc problems and have no pain.
Right.
But ultimately, regardless, they will all have pain. This is why he's had a disc problem for many years but never experienced pain. And the pain came sudden and affected him all at once.
Yes.
That is common. It happens to a lot of patients. Now, this is why I tell patients, having no pain does not mean you're healthy.
Right.
Okay. Pain is not a measuring stick. You can't. It's not a health stick. You cannot measure it by severity of pain you have.
Right.
Because some of the worst diseases that we go through has no pain.
Okay. So, Mr. Chong, would are you still going on for the treatment?
Yeah, I'm having maintenance at the moment. That's right.
Only maintenance now.
Maintenance now, yes. Once every 2 months.
They're like chiropractors, mechanical engineers.
Right.
Yeah.
Fixing you up here and there.
Yes.
Okay.
Without talking anything.
Okay. All right. We'll take another short break, and when we come back, we'll conclude everything right here on BizTalk.
current issues, latest headlines, illuminating visuals. Everything right and now on Bernama News.
Right, thanks for staying with us on BizTalk. If you have any comments, you can email us at biztalk@bernama-tv.com, or you can tweet us at biztalk502, or you can call us at 0326937008. And back with us is Dr. Yama and Mr. Wasim. So we were talking about, we know about the services that you have, about the centre as well. So you mentioned that with the help of MIDA, you were able to build up the centre. So probably you can elaborate more on that and the programs that we have.
As I said earlier, I wanted to find a country outside the US where it would be affordable for me to do R&D, and I could do R&D relatively well. So looked at many countries, and finally someone suggested to me, a friend suggested, look into Malaysia. And I was hesitant because I didn't know where Malaysia was. So
you did not know? Oh no.
I'm sorry, my geography was horrible. It's horrible. Not anymore. So finally I got introduced to MIDA. And they flew over from Chicago, and we had a discussion. They assisted me and gave me information. And when I found out that English is a second language in Malaysia, I was static. And when I found out also it's a Muslim country, again, I was very static. So these are two positive things for me. Communication won't be an issue, and food wouldn't be an issue. So this would be a blessing both ways.
We have a lot of spicy foods here.
Not only that, halal food. So this was a very big thing for me, personally. And then I was invited to attend a talk by the then Minister of Trade, I think, Rafid Aziz.
Yes, that is true.
And I attended her talk, and that was in Los Angeles. And when I listened to her, I was done. I was sold.
You were sold.
She was an amazing lady. She probably still is an amazing lady. So she explained what Malaysia is very well, and what Malaysia can offer. And MIDA continued to assist me throughout the entire process. And then we came to Malaysia. And
and
the rest is, And to this day, they offer assistance whenever we need.
Still?
It's still there.
By saying that, Wasim, we are moving towards the high-income nation. How do you think that, by bringing this franchise up, and we can help Malaysia economically?
Well, of course, we employ people here. We bring our business here. Dr. Yama produces his machines here. We plan to export. We plan to actually take this on a regional and a global scale eventually. So we foresee, at the moment we have a staff of 20 people. But we do foresee a growth even within Malaysia to 50 to 100 people in the medium term. And of course the supporting industry, manufacturing, will definitely see the benefits of people like us coming and investing and setting up here in Malaysia. There is actually, I would like to compliment Malaysia. We found a lot of very humble people, very nice, suitable staff for our business. They make our patients feel comfortable. It's a very hospitable place to be. It is really the heart of Asia for us. And we found success in that model. It's a good combination for us. And so, yes, we see economic development for our company really complementing greatly what you're trying to do here in Malaysia.
By saying that as well, we know that we do not have chiropractic program as much as overseas. So do you find that a little bit like a hurdle for you to bring up more on the chiropractic center?
We do. That's a very good question. Perception is, as I represented earlier, that chiropractic is a bit touchy-feely, but the truth is we're accomplishing results. I mean, we showed you real technical results today on film, before and after. We brought patients with us who are backing us up. We're achieving results, and this is why in North America and in Europe it's already considered conventional medicine. It's already recognized and covered by insurance companies, for example. Here we still have that hurdle to
overcome.
To overcome. Essentially, we're starting our address towards these insurance companies, towards the bodies, to show them what we've actually accomplished, and there we want to see some results back possibly be listed as an alternative provider of care.
Right.
For, by the way, surgery, vastly expensive.
Yes.
Painkillers and these,
yes.
Actually, sometimes they even tell you on the way in, we have a 60% likelihood of success.
Right.
I mean, that's your odds. Someone's going to actually manipulate, I mean, cut you open, and you've only got a 60% likelihood of success.
Right.
Now, the patients we choose and the base we've worked with about 3,500 patients over 7 years, we've accomplished a high 90% success rate. So very rarely do we find a patient we cannot treat with this system.
Right.
So again, it's something unique. It is something that has not been done, not only in Malaysia, but actually in the world.
Right.
We're doing something very unique right here in Malaysia.
Can chiropractic centers can be, tourist attraction as well, like any other wellness or medical centers here?
We have many patients from all over the world that are coming to us right now. We have patients from the Middle East, from Africa, from Europe, from Asia, from all over the world, actually come specifically for our treatments to our centers. This is not people going from Asia to Europe for treatment. These are Europeans coming to Asia.
Especially Malaysia.
It's reversing, because the kind of treatments that we can offer in our centers, they cannot find in their home countries. They do not have this system in Europe. So to say, and also I want to point out that we're much more than just a chiropractic office. It's unfair to the physios that work at our centers to say that we are only chiropractic. We are chiropractic, physiotherapy, and more. And more would be our equipment, the equipment that we have, the spinal decompression. But I'm not talking about the traction machines that people call spinal decompression. I'm talking about a real spinal, a true spinal decompression. A computerized, state-of-the-art equipment. That physiotherapy, chiropractic, three things combined. We're more than any of ours. So we've created something that is truly unique. And end result is that Malaysia will benefit in it from several ways. One, the transfer of technology that's there. The improvements of the physiotherapy profession in itself, and what we can learn from each other. The cross interrelationship between the physiotherapy and chiropractic, which is happening here in Malaysia through our centers. And sharing and learning from one another. And not only that, but also bringing people from abroad. Right now, we have been in discussions with a Saudi company, healthcare facility there, that they want to import our system, our technologies into their facilities. So they will be bringing over the staff that we train, and they want our staff to go over there to train them. So now Malaysia is transferring technology over to the Middle East and other countries.
And with that, we also need a lot of chiropractors as well.
Of course.
In the future, probably thinking of opening a college or a small institution for that?
Probably not. IMU is doing a good job, and I have no idea. I think they will do a good job. I have not seen any of their graduates yet, and hopefully there soon will have their graduates coming on. And we will have to train them more, because we will have to get them accustomed to the way we do
and the patients as well. We are almost to the end of the program, so what would you like to say to the viewers about your center?
Well, I'd like
I know that you have that event or something like that.
Well, I'd like to boast about one patient. On starting this Monday, we had an extreme sportsman from the UK. He traveled all the way from Sheffield. He spent money on travel, on accommodation, just to go through our decompression for 8 weeks continuous.
That's it.
Yeah, that's it. He's here right now. He's getting treatment in our clinic.
Is he getting better?
He's getting better after the 4th session. He's already reporting an improvement. And it's after 10 that we expect to have him out of the pain zone. And the remaining sessions will be really to stabilize him, to get him into a condition where he can maintain his own condition and not have to fall back onto decomp. So it's actually, I mean, it's a success story, and we're really looking at how we can leverage medical tourism from our perspective. Absolutely.
And for your viewers, if they're interested, we are going to be in PWTC this weekend actually. We will at the international franchise shows there. We have a booth there representing our franchise and our clinics, and we will also be doing spinal screenings there. So if anyone's interested to find out more about their spinal conditions, they're more than welcome to come by at our booth. And
or
then
they
get
can go to your website.
Or they can go to our website, mycairo.com.my.
All right.
And
where else can they find you besides that?
They can find us at our offices in Bukit Damansara or in Ara Damansara.
Oasis Square.
Oasis Square. Our office main number, if they get confused, 2093-1000. And the Ara Damansara number is...
I think it's over here. I have it here, I think. Or I have the Bukit Damansara. Or is it this one?
You have on my
785999919.
Yes, the easier number is 2093-1000. Call that. Ask for the closest clinic near you.
All right, so thank you so much, Dr. Yama and Wasim, for being with us. And not forgetting Dr. Kimball, where we had and 2 patients as well. So thank you so much for tuning into BizTalk, and I hope we meet again real soon. And I am Surati Sanusi. Goodbye.